Hello and thank you for watching this presentation. My name is Claire Gough. I'm a research fellow with Health Services Integration and Policy at the Caring Futures Institute at Flinders University and the co-chair of the mHealth Specialist Interest Group for Isbn-Parr. I'm also going to discuss today some of the work that I have been doing in a previous role as a research fellow with ARIA, the Aged Care Research and Industry Innovation Australia, and share some of the resources that we've developed for you to have a look at. They might be able to support your work. Before I begin, I'd like to acknowledge that I'm meeting and recording this presentation on the land of the Gough people, and I would like to pay my respects to their elders past, present and emerging, and I extend those respects to the lands that you are watching and joining me from. So today what we're going to do is look at bridging care and innovation and look at how the human factors of technology use are really important for an ageing population, not just for care delivery, but for research to make sure that we can collect and analyse data, but also include an older population within these technologies, because we've got many different innovative means. So why are older people different when we think about using technology in this space? And so this is going to give you some considerations, and we, in a couple of weeks at the end of May, will be meeting for a bit of a chat and a Q&A session so that we can discuss this topic in more depth, so that you can consider for your research and your future projects as well. So an overview of this presentation, we're going to look at the issue, what's the problem, what do we mean by technology acceptance and the ageing population, human factors of technology, what do we mean by that? What are the human factors that are important in the uptake and the use of technology? I'm going to share some of my work, some of our team's work, and look at the challenges of using technology and getting older people to accept technology and be involved in studies that might be a little bit more innovative or might involve tracking, monitoring, cameras, accelerometry, etc. And then we're going to finish with some practical tips for research, which might be useful for you to inform your future practices, but also might just give you something else to think about as well. Okay, so what is the issue? Here we know that the integration of innovative technology has the potential to improve efficiency, safety, and quality of care delivery. So I'm going to talk here specifically about an aged care facility, whether that be a long-term care or in the home, or generally just caring for older people and involving them in research so that we understand more about how to improve things for older people and older generations moving forward. Now, despite the knowledge and the proof that we can use technology to improve behaviours and influence behaviour change for nutrition and physical activity, technology support and the uptake for individual engagement and technology acceptance seems to be a little bit more difficult with an ageing population, and this might be because of the older people themselves. It might be because of ageism, because of us assuming what people can and can't do off of previous knowledge, and also those human factors of dependency and the traditional views that healthcare should be delivered by a person, and that face-to-face care and interaction is actually part of the quality of the deliverable. So those are things that we need to be thinking outside the box and almost at that bigger picture, moving on from, okay, what features might be important to how is this going to be received, and that's really what we're talking about today. Okay, if I move that out the way again. So technology acceptance, this refers to how users come to accept a technology, and it considers the barriers to acceptance that we need to work around, and we'll explore those in more detail. So if you're not familiar with this model, I'd recommend doing some more reading around this area. But the technology acceptance model, or the TAM, really works on the intentions of an individual and then the behavioural outcome. So if we use a healthcare professional, perhaps an aged care worker as our example, if that individual is trying to achieve a role and we give them a technology that would be able to help them, if they don't perceive that technology as potentially being useful in their role or being easy to use, then they're not going to have the intention to use that technology and integrate that into their care. And likewise, older people are not going to want to use technology in their day-to-day behaviours if they don't perceive them as being useful and easy. So if we can provide something that will speed up a role, make it more efficient, or perhaps make it safer, like monitoring technologies, sensors in mats to detect falls, etc., then really people are not going to use technology. And that sounds really quite straightforward, but here we've got to think about multiple people involved. So we might have an older person who might think, yep, technology is great, love to use it. Okay, but we may then have a carer who's resistive, because they may think, okay, well, what if technology takes over my job, and what if it all becomes automated and I'm not needed anymore? And then on the other hand, we might have family members and caregivers, informal caregivers, who are wondering, is this safe? Where's this data going? Does this put an individual at risk? And so we've got this ethical consideration and bubble around things as well that we might need to consider in this space. So we know that in addition to the issue of the fact that we've got a bit of an issue with uptake of technology, we know that globally our population is ageing. So here in Australia in particular, we know that in the coming years, as the baby boomers hit retirement, push towards requiring additional services in the later years of life, we know that we're not going to have enough aged care support services or healthcare systems to be able to provide the care that will be needed. So the focus here has been on ageing in place and getting people to stay at home for as long as they possibly can. To do this, we are going to need to use innovative technologies to monitor and support individuals in their own home, enabling them to stay at home for longer, but also improving their quality of life as well. So we've got some work to do to push towards acceptance, but also understanding that our aging population is changing, and so our approach needs to change as well. So what are the human factors of technology? Well, these refer to various aspects of human behaviours and capabilities and limitations that influence how we might interact with and use technology. So technology, for example, needs to be easy to learn and use, and so it therefore should include features that are easy to navigate. So if we've got technology that we're trying to use with older people, we might need to consider declining vision, hearing and dexterity, that they might be an issue. And so this would need to be considered in the design phase of the technology to make sure that the technology is usable, easy, accessible for individuals. So we're going right back to the design phase where we consider who is going to use that technology. But it's really more than that, because you could give someone a technology that caters to all of those needs and they still might not want to use it. And so the human factors are really very influential, but a little bit more complicated depending on the situation, the individual, their personality, and also their previous experiences. What are their experiences of technology growing up? Were they born as this generation are, when they know how to use a screen and they know how to swipe each way? Or has technology been something that's been really very new? They've not grown up with it, it's not familiar. How do we overcome that? And perhaps education is something that we need to consider. So although I'm talking about technology use for delivery of healthcare, you can see how here this is something we need to consider when we are delivering research and interventions. Are we thinking about the bigger picture? Is it a technology that perhaps is or isn't useful for an individual to use to increase their activity levels or change their eating behaviours? Or is it the bigger picture? Is it the human factors that are actually influencing our results? So our work, and I'm just going to talk through, I've added a link in one of the final slides for these resources if you would like to have a look. But with ARIA, we carried out a rapid scoping review to determine the levels of evidence and publications that had considered human factors of technology for older people. And so there wasn't a huge amount, but there were some really key themes, which you can see here on this imagery. So attitudes towards robots, engaging with virtual reality, maintaining dignity, that quality of human interaction, which I've referred to previously, were things that came up repeatedly, all impacting on the technology acceptance, telehealth acceptance, and the use of technology. But really there was a particular focus on individuals with dementia using technology and how that might be used to support their care, but also understand a little bit more about them being able to detect decline and therefore put supports into play that might be able to help. And when we're thinking technology, it might be as simple as reminders to take medication, or technology that can ensure that the stove is turned off after cooking a meal. So a lot of this you can see, although I've split them into different key themes, they're all very much interrelated and can have a significant impact on the quality of life, not just on the individual, but their family members and their support networks as well. So it is a complicated consideration. From that work, you'll see here, and you can have a look at the link on the ARIA website as well, but we've come up with some resources that summarise what the evidence says and what the practical implications of these particular human factors of technology might be. And the intention of these evidence themes and the PDFs that we've produced is that we can upskill the workforce so that people looking after, caring for, working with older people understand what the barriers and what the concerns might be, but also have some tools to be able to work around those as well. So please do use those resources. Feel free to share them. They are a free resource. So what are the challenges? Well, if we're thinking about an older population, within the literature and the evidence and experiences of people that we've spoken to, the initial robots that were presented in Hollywood sci-fi movies were actually really very scary for individuals watching early television. And they were often depicted as attempting to take over the world and quite violent. So although we've got more friendly looking robots now, we understand what they can do and how they can help. We might need to delve a little bit deeper. If we're getting some resistance from an older person or their family, the attitudes towards and around robots were really quite extreme. And so for the use of robotics to be useful with ageing populations, we need to determine the perceptions and the experiences and expectations of the people receiving care, the older people that we are researching, as well as the features and the commonalities of what that device and what that robotic might be capable of. In the same breath, we've got this massive ethical consideration, because with robots, we know that they've got built-in cameras to be able to move and get around. So we've got an ethical consideration around that privacy and safety here as well. So every new technology that we use with older people, introduced into aged care settings or healthcare delivery, needs to be assessed against the basic moral and ethical principles of care. So using that moral compass, are we going to have gains, and do they outweigh the harms of using this technology? So these include respect for autonomy and privacy and doing no harm. The technologies should not threaten human rights or the quality of life of older adults in any way. So this might be a bigger picture that we need to consider. And one of the key examples that comes up in the literature and clinically as well quite often is if we're monitoring and we're detecting a location of an individual, perhaps they've got dementia, are they able to consent to that? And as someone who's following a loved one or a researcher who's watching and looking at the locations visited and the home addresses of older people, have I got good intent? Am I using that data for good, or am I using it for harm or evil, in the opposite effect here? And actually, am I putting that individual at risk? So these are some key ethical considerations that really start to go hand in hand with those human factors. And perhaps you'll understand here why family members might be resistant to some technologies that we are looking to use. And so those are some big challenges to consider. Unfortunately, in the world of 2025, there are lots of scams going on, and a lot of these are financial, and older people have been targeted along with more vulnerable populations. So older adults can be fearful of technology. They might be advised by loved ones not to pick up the phone, not to be involved, not to log on to the internet because it's safer, so that they don't lose their personal information. And so here the recommendations are in future work that we need to consider the importance of cybersecurity to inform a code of conduct for technology use in aged care specifically, but more generally with older adults. So if this is an area of interest, then that might give you some work for the next 10 years to start developing that. But we need to consider safety as something that really came up very regularly within the literature and within the evidence that we have looked at for human factors. So to pull up for particular populations, older people and their families, the ethical issues here is that people don't want technology controlling their lives. They don't want technology to take over. If we've got individuals with cognitive decline, how do we get them to consent to using technology? And is that consent informed? Do they have the capacity and the capability? With face-to-face care, this seems to be the preference. So we don't want technology to take over the face-to-face traditional care, but we need technology to be able to support the care and our research. And so then the other ethical issue that we came across was that some people felt that robo-pets, so a form of robotic pet that we use with older people in aged care, specifically nursing home and residential aged care facilities, infantized older people. So they felt like this became childlike, and that was actually quite offensive to some of them and to some of their family members. So you can see here the perceptions and the human factors that are in fact creeping in. Computer literacy is a big one. Are we enabling people to be involved in our interactions, in our interventions, or do they have poor computer literacy? Do they need education to be able to participate actively, or are we excluding people? Concerns for privacy and safety, we've talked about already, and there are numerous examples of insecurity around that for older people and their family. But really, some of these technologies can be used to ensure that older people can live independently for as long as possible in their homes, can support memory and increase social interactions if we're looking at social interactions, online interactions, video cams, webinars, etc., etc. So how do we support acceptance? For older people, they're more likely to accept technology such as surveillance cameras and robots if they can assist them to live independently. So it might be that our older populations are more open to having a robot or a surveillance camera in their home environment if it means they do not need to enter an aged care facility. And so service providers and researchers, we need to balance integration of technology and the importance of that face-to-face human care. With this acceptance, we've got to consider the acceptance of aged care the workforce. Some were very concerned that there would be a loss of job and opportunities because individuals would be replaced by technology. If we've got a robot roaming around and someone falls over that robot, who is liable if something goes wrong? So again, we've got this safety, this security, this making sure we're not liable and that actually delivering care in the best possible way. Who's responsible for charging and maintaining the technology? So we don't want to add additional burden on a workforce that's already extremely stretched. So who is going to take control? And then here again, we have concerns over the privacy. So if an individual is using telehealth and the carer comes in and supports them to set that up, they possibly are in shot of the camera, and how do they feel about their own privacy and where that data is perhaps being stored? So we've talked about a lot of clinical examples, but what does this mean for facilitating the uptake of technology and the use of technology in ageing research? Really, it comes down to co-design with the end users. So we need to make sure that the technologies that we're looking at, whether it's for data collection or interventions, is tailored to the individual. So is the technology suitable for older people to use? The technology needs to make sure that it doesn't replace face-to-face care, but actually enhances the care. And a lot of technology has got stereotypes and stigma, and we need to make sure that we're not introducing any ageism into the use of our technology. So we might say, well, we're not going to use an iPad and we're not going to track older people because really they don't understand how to use these devices. So we're not going to get very good data. Well, how do we know that if we don't give people the opportunity and we don't do this work? And we also need to consider that the older population will change and we will eventually get to the youth of today who have grown up with technology and mobile phones in their hands. So this is going to change. And so our clinical approaches and our research methodologies need to change to keep up with the innovation, but also to consider the changing in demographics and population. Communication between all stakeholders, specifically in the design and the use of technology, is really important. Personal preferences should be considered and accommodated, pushing towards people being secure and promoting their autonomy. Technical support is very useful and should be available at all times if you are requesting people to participate and use technology and innovative technology in interventions. And so education and explanation around that might be useful as well in explaining why and what the benefits and the potential might be. when we look at technology and we use technology with children, we really focus on making sure that technology is entertaining and stimulating. So why should that be different with older populations? And I love this photo here of this gentleman having a great time with virtual reality. I think the smile says it all. So making sure that it's enjoyable is definitely going to improve acceptance and make sure that the uptake is wider, longer, lasts longer, etc. And we need to assess each environment for the suitability of technology. So safety does really come in as something that we need to look at. We need to make sure that using technology does not increase the risk of tripping and falling and add additional hazards to the lifestyle, the homes, the environment of older people. So these are some of the recommendations that we might want to consider. And so some more practical tips. To ensure that older people use technology, whether it be monitoring or interventions, considering their comfort is very important. So for individuals using virtual reality goggles and headsets, are they padded? Are they comfortable? Are they in a good position? That could be something that influences the uptake. Can the person engage effectively with the technology, or do they need support? Do they need someone there to encourage them and be part of that? Is the technology suitable for the individual? Is there a better alternative? Not every technology is going to suit an older population, and that's okay. But let's make sure that what we're doing is appropriate and safe. Does the environment suit moving around safely? If we're looking at interventions of virtual reality, etc. And are they able to use technology safely? Are we recording individuals' personal details in a safe manner, or can we input details anonymously where they're not going to be at jeopardy of being accessed by other people? Another consideration is infection control, and following COVID-19, hopefully this is more of an awareness, but really in previous interventions, taking a device, especially because of some of our technology devices are really quite expensive, we might not have enough to go around. Looking at infection control and making sure that we're cleaning devices in between use is really quite important. And again, fun, novel for the individual. That might be how we get some additional buy-in and really get around some of those human factors that might prevent the uptake of technology. So in summary, technology and innovative technology can be used to successfully provide care and carry out research with older people. Considering human factors perhaps is something that should be essential and part of your planning phases for research studies, for interventions, to make sure that the technology is appropriate and that you've thought about all of these possible human factors that might influence and preconceived ideas and make sure that ageism isn't an issue. So we need to make sure that our data is not ultimately affected and impacted by ageism or our own bias, and that it's appropriate. And we understand that each individual will interact with technology differently. So how can we use that in our clinical care, and how can we consider that within our research and our interventions? How are we going to record that? Moving forward, we really need to consider the balance between technology to improve efficiency of everyday procedures and the quality of data collection, with the perceptions and the ethical concerns that older people, their family and their carers may potentially have. So hopefully I've given you some food for thought today and things to consider. If you want to find out more, please watch the next presentation in this series by Gordana. She's going to take us through a specific example of adoption for health smart homes, which will really give you a specific example to carry through and consider how some of these human factors have either been important, how they've been challenging, and what the team have done there to overcome some of those challenges. To follow up from these presentations, we are going to have an in-person live Q&A webinar type discussion where we will answer questions about these presentations and have more of a conversation around these topics that you might find useful. So you can find the details of your time zone on the IBSPN website with the link to be able to register with that and get the Zoom link. In addition, you can use the resources I've shared with you today and have a look at the ARIA website, or reach out via email. I'd love to connect and potentially hear about what you're doing and have options for working with you in the future. So thank you very much for listening today. I look forward to hearing from you and joining you for the Q&A discussion later this month. Thank you.